How to help prevent heart disease at any age. You are never too young or too old to take care of your heart. Preventing heart disease and all cardiovascular diseases means making smart choices now that will pay off the rest of your life. Lack of exercise, a poor diet, and other unhealthy habits can take their toll over the years. Anyone at any age can benefit from simple steps to keep their heart healthy during each decade of life. Here's how all age groups, no matter what your age, everyone can benefit from a healthy diet and adequate physical activity. First, choose a healthy eating plan. The food you eat can decrease your risk of heart disease and stroke. Choose foods low in saturated fats, trans fat, and sodium. As part of a healthy diet, eat plenty of fruits, vegetables, fiber-rich whole grain, fish, preferably oily fish, at least twice per week, nuts, legumes, and seeds. And try eating some meals without meat. Select lower fat dairy products and poultry. Limit sugar sweetened beverages and red meat. If you choose to eat meat, select the leanest cuts available. Next, be physically active. You can slowly work up to at least 2.5 hours, 150 minutes of moderate intensity aerobic physical activity. Example, brisk walking every week or 1 hour and 15 minutes of vigorous intensity aerobic physical activity. Example, jogging, running, or a combination of both every week. Additionally, on 2 or more days a week, you need muscle strengthening activities that work all major muscle groups, example legs, hip, back, abdomen, chest, shoulders, and arms. Children should get at least 60 minutes of activity every day. It's never too early or too late to learn the warning signs of heart attack and stroke. Not everyone experiences sudden numbness with a stroke or severe chest pain with a heart attack, and heart attack symptoms in women can be different than men. In your 20s, find a doctor and have regular wellness exams. Healthy people need doctors too. Establishing a relationship with a physician means you can start heart health screenings now. Talk to your doctor about your diet, lifestyle, and checking your blood pressure, cholesterol, heart rate, blood sugar, and body mass index. You may also need your blood sugar checked if you are pregnant, overweight, or have diabetes. Knowing where your numbers stand early makes it easier to spot a possible change in the future. Be physically active. It's a lot easier to be active and stay active if you start at a young age. If you are accustomed to physical activity, you will sustain it. Don't smoke and avoid secondhand smoke. If you picked up smoking as a teen, it's time to quit smoking. Even exposure to secondhand smoke poses a serious health hazard. Non-smokers are up to 30% more likely to develop heart disease or lung cancer from secondhand smoke exposure at home or work, according to US Surgeon General report. In your 30s, juggling family and career leaves many adults with little time to worry about their heart. Here are some ways to balance all three. First, make heart healthy living a family affair. Create and sustain heart healthy habits in your kids and you'll reap the benefits too. Spend less time on the couch and more time on the move. Explore a nearby park on the foot or bike. Shoot some hoops or walk the dog. Plant a vegetable and fruit garden together in the yard and invite your kids into the kitchen to help cook. Know your family history. Shake down your family tree to learn about heart health. Having a relative with heart disease increases your risk, and more so if the relative is a parent or sibling. That means you need to focus on risk factors you can control by maintaining a healthy weight, exercising regularly, not smoking, and eating healthier. Also, keep your doctor informed about any heart problems you learn about in your family. Tame your stress. Long-term stress causes an increase in heart rate and blood pressure that may damage the artery walls. Learning stress management techniques not only benefits your body but also your quality of life. Try deep breathing exercise and find time each day to do something you enjoy. Giving back through volunteering also does wonders for knocking out stress. In your 40s, if heart health hasn't been a priority, don't worry. First, watch your weight. You may notice your metabolism slowing down in your 40s, but you can avoid weight gain by following a heart healthy diet and getting plenty of exercise. The trick is to find a workout routine you can enjoy. If you need motivation to get moving, find a workout buddy. Next, have your blood sugar level checked. In addition to blood pressure checks and other heart healthy screenings, you should have a fasting blood glucose test by the time you're 45. This first test serves as a baseline for future tests, which you should have every 3 years. Testing may be done earlier or more often if you are overweight, diabetic, or at risk for becoming diabetic. Don't brush off snoring. Listen to your sleeping partner's complaints about your snoring. 1 in 5 adults has at least mild sleep apnea, a condition that causes pauses in breathing during sleep. If you not properly treated, sleep apnea can contribute to high blood pressure, heart disease, and stroke. In your 50s, unlike the emergence of wrinkles and gray hair, what you can't see as you get older is the impact aging has on your heart. So, starting in the 50s, you need to take extra steps. First, eat a healthy diet. It's easy to slip into some unhealthy eating habits, so refresh your eating habits by eating plenty of fruits and vegetables, fiber rich whole grains, fish, preferably oily fish, at least twice per week, nuts, legumes, and seeds, and try eating some meals without meat. Next, learn the warning signs of a heart attack and stroke. Now is the time to get savvy about symptoms. Not everyone experiences sudden numbness with a stroke or severe chest pain with a heart attack, and heart attack symptoms in women can be different than men. Follow your treatment plan. By now, you may have been diagnosed with high blood pressure, high cholesterol, diabetes, or other conditions that increase your risk for heart disease or stroke. Lower your risk by following your prescribed treatment plan, including medication and lifestyle and diet changes. In your 60s and plus, with age comes an increased risk for heart disease. Your blood pressure, cholesterol, and other heart related numbers tend to rise. Watching your numbers closely and managing any health problems that arise, along with the requisite healthy eating and exercise, can help you live longer and better. Have an ankle-brachial index test. Starting in your 60s, it's a good idea to get an ankle-brachial index test as part of a physical exam. The test accesses the pulses in the feet to help diagnose peripheral artery disease, that is PAD, a lesser known cardiovascular disease in which plaque builds up in the leg arteries. Next, watch your weight. Your body needs fewer calories as you get older. Excess weight causes your heart to work harder and increases the risk for heart disease. High blood pressure, diabetes, and high cholesterol, exercising regularly, and eating smaller portions of nutrient rich foods may help you maintain a healthy weight. Next, learn the warning signs of a heart attack and stroke. Heart attack symptoms in women can be different than men. Knowing when you're having a heart attack or stroke means you are more likely to get immediate help. Quick treatment can save your life and prevent serious disabilities. Thanks for watching. Meet you in the next video. Do like, share and subscribe to our channel and hit the bell icon for more interesting updates.